Hey, Carlos. How's your week going?
You know, it is going well. It is filled with optimism. I'm about to make my way down to Los Angeles from the Bay Area, so it'll be the first time in L.A. in over a year, so I'm looking forward to that.
Wow, you're getting back out on the road. I think that's kind of, the symbol of what we're talking about this week, America moving again.
Indeed. I feel like I'm hearing more people in that regard. I also, I'm proud to say, got my vaccine appointment. So I've got an appointment for tomorrow.
Yeah, I think it's been amazing looking at the numbers. I pulled up that flight tracker thing. I don't know if any of you have ever seen that. You can look live at the number of flights that are anywhere in the sky at any one time. Basically, America is full of aeroplanes in the sky. And then you kind of scan over to Europe, and there are still very few flights going on in Europe. And the kind of contrast, I mean, it's a great visual image of the contrast between Europe's approach at the moment and where Europe is in terms of COVID and where America is in terms of COVID.
That is really interesting. Well, one of the interesting pieces of this, I think, too, has been Biden's approach to the vaccination thing, not only trying to speed things up, but I think in an interesting way, setting expectations a little further out and then constantly kind of over-delivering against them. And I think that is, I assume, if things work out better over the next year, that will be one of the things that people compliment him for.
Yeah. Smart politics in action, it looks like, certainly at the moment anyway, and using this crisis in a very big way to drive very big changes in the country. He may not get all of those changes, but there's certainly a sense that he's not the caretaker president. So far, at least, it's early days, of course. We're not even at 100 days, but he's not at the moment looking like the caretaker kind of sleepy president that some people thought he might be.
You're calling him Teddy Roosevelt. You're saying he's speaking softly, but wielding a big stick. Oh, my. Okay.
He's wielding a big vaccination injection.
There you go. Better said. Better said.
A big needle. A big needle, if not a big stick.
Yeah. Wielding a big needle and a big checkbook. Both.
Yeah. Which is our subject this week. Let's get on with it. Hello, I'm Katty Kay in Washington.
And I'm Carlos Watson in California.
Welcome to When Katty Met Carlos,
a new show exploring what's shaping America today, brought to you by the BBC World Service and OZY Media. The COVID pandemic has exposed America's vulnerability. The U.S. has had more than 550,000 coronavirus deaths, the highest number in the world. But there's some good news. The country's vaccination program is progressing at a staggering pace. During Easter weekend, in one day alone, more than 4 million Americans received a vaccine, the highest one-day total since the start of the rollout in December.
Yes, and as we speak, America has fully vaccinated around a fifth of its population. For people aged 65 and over, more than 3/4 of them have now had some level of protection from a single jab. But despite this apparent success, there are a number of top health officials who are saying that they're worried. New variants of the virus that are taking hold in the U.S. are more infectious and could be more deadly.
President Biden has announced he's bringing forward the date by which all adults in the U.S. will be eligible for vaccination by 2 weeks to April the 19th. But he's also told Americans to continue to be careful.
There's a lot of good news, but there's also some bad news. New variants of the virus are spreading and they're moving quickly. Cases are going back up. Hospitalizations are no longer declining. While deaths are still down, way down from January, they're going up in some places. The virus is spreading because we have too many people who, seeing the end in sight, think we're at the finish line already. But let me be deadly earnest with you. We aren't at the finish line. We still have a lot of work to do. We're still in a life and death race against this virus.
The president has warned against reopening the economy too quickly and urged governors and mayors to reinstate requirements to wear face masks.
But it's up to the individual states themselves to decide what to do, and many of them have been rolling back restrictions. Last month, Florida, which never actually had a mask mandate, welcomed tens of thousands of tourists for the spring break holiday. Texas ended its mask mandate and allowed businesses to operate at full capacity, including a packed-out baseball stadium. With so much happening so fast, we're asking, is the US at risk of undermining the progress that it's made?
One of the most unsettling realities of COVID has been its disproportionate impact on communities of color. Black and Hispanic Americans have been as much as 3 times more likely than white Americans to catch the virus and up to twice as likely to die from it. But despite this, vaccination rates of non-white Americans have lagged. Our first guest has been working to change this. Cynthia Finch is a retired clinical social worker in Eastern Tennessee. Cynthia, welcome to the show.
Oh, thank you. I'm excited about being here.
Cynthia, when the pandemic first hit, what did you start doing and why?
When the pandemic first hit, I was attending meetings and I heard our leadership at the state level talk about that they were going to reopen churches. I got excited and I started calling everybody that I knew and said, this is not good, this is not good. And on May 1st, the governor was going to release that opportunity for churches to open. And I thought, oh, not here in Knoxville. So we began to meet faith leaders, churches, healthcare professionals, church ministries. And on May 1, we met. And today, every Thursday, we talk about and meet and talk about what we can do to keep our community safe. So that's the first step we did, is to tell people, do not open your churches, stay closed. So we began to put the word out.
So, Cynthia, let's fast forward from what you were doing in March to what you're doing now, because you're still working to try and help your community get through this pandemic and specifically to try and get people vaccinated. Because we've been hearing over the course of the last few months that access to vaccines in communities of color has been a problem. There just isn't the healthcare distribution that there is in many wealthier white communities. So what have you been doing specifically to get vaccines into the arms of people in your community?
Well, initially, when they started saying how people could register, that became an immediate problem because people did not have the understanding how to go onto a computer. Their broadband access might not have been there. Calling and staying on the phone, you're on hold for many, many, many minutes, even sometimes hours. That's discouraging. So what we did is we started creating our own list. And there's been an article written about Cynthia's list. So what would happen is we'd get all of the names of individuals, and then we would call the health department. We would call people in hospitals that had access to the vaccine, and we'll say, we have 50 names, we have 100 names, we have 1,000 names. Can we get an appointment for these individuals? So once the people who have the vaccine realize that we have created an access for people of color to get into the lines. And then my phone started ringing off the hook and it would say, may I get on your list? May I get on your list? And so we just began to have thousands and thousands and thousands, specifically people of color, specifically African Americans. And guess what? This past weekend during Easter, we had our first drive-through vaccination clinic. We vaccinated 1,000 people and they cried from their windows because they said, thank you for coming. Thank you for sponsoring this vaccination clinic so we can be safe, so that we can go to the next month, so we'll be here next year, so we can see our grandchildren grow up.
Cynthia, first of all, thank you for all you're doing. I love hearing that, and I can't see Katty, but something tells me she's smiling when she hears about that list.
I think you must be famous,
well.
Cynthia.
It is famous, the list. Yes.
Cynthia, take a step back for me just for a moment. When you think about all that has happened with COVID, sadly people passing away, sickness, and now people beginning to get vaccinated, are there any longer-term changes that have come out of what is obviously a very difficult period?
Well, I think the number one thing is that relationships have been created. Partnerships have been created. Never before in the history of my work, and I've been in healthcare some 30 plus years, have I seen hospital systems come out of their buildings to the community. So we have created relationships, networks have gotten deeper, people are talking to each other, volunteers are coming out of the woodwork to say, how can I help? How can I help? So I feel that the work that we have been doing with our Faith Leaders Initiative, where we have gathered up over 180 plus pastors, healthcare professionals, health ministries, and other agencies, that partnership has really saved the lives of my community. And I think this movement that has been created here in Knoxville can serve as it has served as a catalyst for our city. It's caused people to start talking to each other. It doesn't matter whether you're black or white or whether you're Latino. It doesn't really matter. But I do know that we have created an opportunity for people to come to a safe place, to come to our clinics, to come to clinics that are happening all over our community and feel safe that they're not going to be picked up by ICE. We tell them, you don't have to have any ID. You just come, and we're going to be able to give you a vaccination. So we said, the health department, you keep doing health department, public health. We're going to do community public health. And that's exactly what we've been doing with our pop-up clinics. And we've been putting the needles in the arms. I can tell you that.
Well, Cynthia, thank you so much for the work that you're doing and for sharing your story. It's great to hear in this tough year that we've all had, and that African Americans and Hispanic Americans have had, particularly in the country. It's great to hear that there is some opportunity and something is changing and that you are driving that change. Cynthia, thank you.
Thank you. Thank you for the opportunity.
Cynthia, thank you for what you're doing. Be safe and be well.
Thank you, sir. It's been a blessing.
One big worry is about new COVID variants, which the vaccines could be less effective against. One that's already reached American shores is the variant first discovered in Brazil, known as P1. Here's Brazilian doctor Miguel Nicoleles.
I think Brazil now is not only the epicenter of the pandemic worldwide, is a threat to the entire effort of the international community to control the pandemic in the planet. If Brazil is not under control, the planet is not going to be under control. It's not going to be safe because we are brewing new variants every week.
Well, our next guest is one of the world's leading epidemiologists. Dr. Michael Osterholm is director of the Center for Infectious Disease Research and Policy at the University of Minnesota. He was also a member of President Biden's 13-member Transition COVID Task Force. Dr. Osterholm, welcome to the program.
Thank you very much.
When you hear the doctor there in Brazil talking about Brazil being the epicenter of the pandemic now and the potential for that epicenter to spread to other countries, are you concerned that what's happening in Brazil could derail America's progress?
Well, Brazil is today. The rest of the world is tomorrow. And I think that what we have to be mindful of is that when we're only talking about getting vaccine in any meaningful way to the high-income countries, in fact, 10 countries today have received over 80% of all the vaccine doses, and that 30 countries have received literally no vaccine. And we don't see that changing substantially over the course of the next year to 2 years based on current manufacturing possibilities and distribution plans. So we're going to see variants spitting out of the low and middle income countries around the world over the course of the next year or two, unless we are able to really up our manufacturing capacity, get vaccines to these areas. If that doesn't happen, we have to expect that our vaccines in the high-income countries are going to be constantly subjected to challenge by these new variants spinning out of these low and middle-income countries.
Sorry, when you say that what's happening in Brazil today could be the rest of the world tomorrow, you really think that we could get into a situation that Brazil is in? I mean, their hospitals are completely overwhelmed. They've got people lying in corridors. It's a nightmare what's happening there. You think that could come to America?
I don't think that that's a situation that I worry about right now in the high-income countries per se. I worry very much about the rest of the world. As much as we just heard about Brazil, we're also seeing parts of India light up right now that we haven't seen before. And so what I'm suggesting is in the billions of people in low and middle-income countries, Brazil is a possibility anywhere in those countries. As far as the high-income countries, for most of the variants that we've seen to date, the vaccines that we do have are effective. What we're concerned about is, of course, those few that have emerged in places like Brazil, South Africa, that include at least one specific mutation. It's called E484K. And that particular variant is one that does evade immune protection from both the vaccines and from previous infection immunity. How much it evades is yet unclear. We're following that right now very closely in Canada. In the province of British Columbia, P1 has now taken off, particularly around the ski resort area of Whistler. And this is going to be a question that we have to answer. How much do these new variants that do impact on immunity actually play? If they don't, and they don't spread substantially, then we have a relatively bright future in the high-income countries. If, again, we don't see new variants emerge out of the low and middle-income countries that don't have vaccine.
Michael, when you think about these variants, and if they do in fact get worse, and if we continue to see more and more variants, does that suggest to you that even people who've been vaccinated are going to have essentially follow-up jabs or follow-up vaccinations to address new variants as they emerge?
It's surely possible. It's also possible that we will be looking at devising new vaccines, ones that will be what we call second or third generation vaccines beyond the ones we have now. I think the most important thing we can do is understand our own capabilities against this virus and with great humility acknowledge that there are a lot of questions that are left unanswered. Will these vaccines sustain us through a time when we can see most of the world control the virus? Will we need new vaccines? Will we constantly be challenged by variants from the low and middle income countries if we don't, in fact, provide vaccine to those areas? And then finally, even kind of you might say an addendum to all of these comments is the fact that we still have to appreciate how many people in high-income countries will actually take the vaccine. I worry that in the days ahead, we're going to go from not nearly enough vaccine for the number of arms that want it to more than enough vaccine trying to find arms to take it. And in that situation, I think that we could still see sustained transmission here. I look at the United States right now, and people have said, well, we're not going to have a problem. We have so many people vaccinated or previously haven't been infected and now have protection. Look what's happening in Michigan. Look what's happening in Minnesota. Look what's happening in a number of areas out there. Despite having above the average amount of vaccine delivered in those states, we're seeing very rapidly increasing cases occurring with B117.
And just to clarify, and at the risk of sounding like a wannabe epidemiologist, which I most certainly am not, Michael, the B117 is the UK variant. The P1 is the Brazilian variant. You mentioned another variant, the E484K, which I hadn't heard about. And in that respect, I've got a question for you. My understanding is that the US does not do as much genome sequencing to determine which variant is in the country and which variant has infected somebody as the UK does. So we don't really know which variants are here and how widespread they are. Why not? I mean, this is, such an advanced country. Its vaccine rollout has been phenomenal. The vaccine research has been phenomenal. Why not do more of this genome sequencing so we know what we're dealing with?
Let me just clarify. When I talked about the E484K, that is actually the mutation that is in P1. It's also in B1351, which is the South African variant or was first discovered in South Africa. So the 484 is actually the mutation that's in several of the different variants that compromises vaccine effectiveness or immunity from previous infection. The B117 is, as you pointed out, one that is from the United Kingdom, and it's of real concern to us now because it has been demonstrated to be 50 to 100% more infectious than our previous COVID-19 viruses, and it surely causes 50 to 60% more severe illness. Fortunately, we've seen very, very little B117 acquire this mutation. So B117, because it doesn't have that, is not a challenge for us with beating our vaccines. It's the 1351 and the P1 that are the concerns for that. To answer your question about the sequencing, we have been way behind in this country. This is absolutely unacceptable. The administration has clearly made this a priority. New funds have been moved to the CDC for expansion, working with private companies that are doing sequencing. State and local health departments have upped their game in terms of the number of labs. But right now, we still have a long ways to go to really understanding how common these variants are.
So, Michael, what is the so what for President Biden when you see these flare-ups in Michigan, in Minnesota, and elsewhere? You would have him and his officials do what?
Well, first of all, continue to do what they're doing and trying to get as much vaccine out as possible. I give them great credit. I think this administration has made this job 1, 2, and 3, and they are getting vaccine out. Number 2 is absolutely make it a priority to get the rest of the world vaccinated. We don't have nearly enough manufacturing capacity to do that today, even if we wanted to. That's going to mean we need a combination of a Manhattan Project and a Marshall Plan all rolled into one to take care of low and middle income countries, not just out of a humanitarian reason, but because it's a strategic decision to protect our vaccines that we need to do that. Number three is I do believe we're going to see a surge of this B117 infection spread across the United States over the course of the next 6 to 8 weeks. Surely what vaccination we've done will be very helpful, but it will not contain that. I'm one of a number of people who've come forward urging that the administration consider the immediate first dose, delayed second dose approach that has been used in England, is now being used in Canada. We have compelling data that you can be highly protected with even one dose of vaccine, rather than getting the second dose 3 or 4 weeks later, getting it 8 to 12 weeks later. And right now, if we could double the number of people getting vaccinated every day, that would be really, really important, particularly in these younger age populations that we're now seeing as adults, 30 to 39-year-olds, 40 to 49-year-olds ending up in intensive care units like we've never seen before. And I might add that when the media reports on the current number of people being vaccinated, particularly in the United States, and they say 3 million new people, that's really not true. What we've done is, because almost all the doses going out right now are the 2-dose approach from Moderna and Pfizer, that is also second doses being given. And we have not really materially improved on the number of people getting first doses for weeks. We're still at about 1.6 million per day. So we've got a long ways to go to protect the Americans that we're now seeing who are really at the forefront of this B117 surge.
Michael, as you think about some of our international colleagues and compatriots, besides Brazil, where else are you paying close attention to, and where else can we learn from?
Well, right now I'm pretty much paying attention any place that has people. It is a situation where we're seeing in the Americas a continued number of cases, not just in Brazil, Chile, others are seeing all-time high number of cases, the Philippines. You know, I have said for the past few months that I thought that the darkest days of the pandemic were still ahead of us. And I think most people saw that as hyperbole or just plain irresponsible comments. But let me just share for you why I still believe that and what's happening. When we saw the previous global peak in cases by week reported the WHO, that occurred the first week of January, and we were slightly over 5 million new cases reported. Then the number dropped precipitously over the course of the next 3 to 4 weeks, just like it did in the United States and a number of other countries. And it got down to about 2.4 million, about half of what had been reported in January. And people all took global comfort in the fact that we had started to win the battle against this virus. Well, as of this past week, we are now over 4 million new cases reported, and the rate of reporting has increased substantially. And it will just be a matter of 2 to 3 weeks before we will have more cases reported globally than any time since the pandemic began. So we are not out of the danger zone yet with this virus on a global level, and it speaks to why I'm so concerned about low and middle income countries. They will continue to fuel a very large number of cases globally, and again, create the kind of variants that we're talking about that can surely have big impact no matter where you live.
You know, Michael, one of the questions that I feel like I'm beginning to hear in more and more spaces is, are rich countries, U.S. included, are we hoarding the vaccine? And if so, should we more aggressively stop that, given, as you've described and as we all know, the kind of globally interconnected nature of our lives and of our healthcare?
Well, I can't say that we're hoarding the vaccine. Clearly, any one country is going to prioritize its own citizens first. And what we can put into the global vaccine pool is surely far, far short of what we need, even if rich countries, high-income countries did allocate some of the vaccine to that. What we're missing right now is that Manhattan Project Marshall Plan to how are we going to develop the manufacturing capacity to get vaccines out. You've heard a lot of debate about intellectual property and technology issues. That's not really the concern. It's all about the fact that many of these companies who are currently working in the vaccine space will gladly provide the science and the ability to make vaccines throughout the world if somebody can do it. If you don't have the experience and you don't have the expertise and you don't have the facility, it's very hard to make vaccines, no matter if you want to or not. And what we're not addressing right now on a global basis is what is our global plan? Don't tell me you're going to try to vaccinate 20% of low and middle income countries as the plan. That is far, far short. And so what we need right now is a plan for the high-income countries to subsidize and quickly develop the capacity to get vaccine to most of the world.
One of the vaccines, Doctor, that was a hope for low and middle income countries is the Oxford AstraZeneca vaccine because it is that much cheaper to produce than the others. How concerned are you by what's happened this week?
Well, I have to say that having been in this business 46 years, I've never seen a private sector company with such a critical mission screw up more times than this company has. Now, I happen to believe the technology, very well could be a very critical technology for providing vaccine to the world. And I'm not as concerned, although I don't want to surely suggest that I lack any empathy for these potential challenges with the clotting disorders. But don't forget that in the area of medicine, there are many, many medications that we take for which there are some serious side effects. But when you balance the side effects against the potential benefits, people are willing to take them because they say, if this gives me a 1 in a million chance of dying and this gives me a 1 in 10 chance of dying, you know what? I'm going to take it, even though I know I have some yet risk of having an adverse impact. So I wouldn't write it off as just saying because it has a problem, it's no longer usable. It may end up saving millions and millions of lives around the world. And I think what we need right now is just much more clear, straightforward information about what we know and don't know.
As a kind of follow-up to that, do you think children should be vaccinated, and do you think they will be vaccinated soon here in the States?
Yes and yes, they should be vaccinated. One of the things that has really come out of this B117 situation in North America and Europe is that kids, which prior to B117 surely played a role in getting infected and transmitting the virus to some degree in their communities, but nothing like we're seeing with B117. And what we're seeing, for example, in our own community here is youth-based activities, school, sporting events, social events outside of school are playing very important roles in the transmission of this virus that we didn't see before. And this is why we think we're seeing the big peaks in cases right now in younger adults. It's the parents of these kids. It's the people who are having contact with these kids. And so we desperately need a vaccine for the kids, not only to protect them, but also I think they're playing a very key role in the transmission of the virus in our communities, that if they were vaccinated, that would really help us a lot in reducing that kind of transmission.
Katty, that's interesting. I think what Michael's describing, if I remember correctly, happened in your house.
I think that is exactly what happened in our house. My daughter got it and my husband got it, and she was in school and 6 kids in her school had it that week. And of course, she was fine. My husband, after 3 weeks, is still feeling exhausted and wishing he had never got it. So you're right.
Michael, finally, I think Katty and I were both curious about vaccine passports. We're starting to hear more about that as some schools, as some businesses, others require proof of vaccination. And there clearly are some concerns that could end up having a cultural divide, perhaps a socioeconomic divide. How do you think about this concept of vaccine passports?
Well, let me just say at the outset, they are going to happen. It's not a matter of if. They are going to happen. As a society, we are going to want to know, is someone that we're sitting next to in an airplane or someone we're sitting next to at a restaurant or in a theater, are they infected? Can I feel comfortable coming back into a public space if I don't know if these people are protected, or should they be wearing a mask or not wearing a mask, these kinds of issues? There's a number of challenges, both scientifically and I think politically, about how passports might happen. And that's all got to be worked out quickly. We've already heard from the U.S. government that we are not going to issue electronic passports or immune passports, but we will help develop the standards for them. So I think over the course of the next 6 months, you're going to see tremendous activity in this area. And it very well could be that private companies are going to end up playing a key role here. I willingly surrendered my eyeballs and my fingerprints to a private company so that I could get in and off airplanes in the United States with much greater ease. Will people do the same thing with regard to an immune passport so that they can go to these venues I just talked about or get on an airplane?
Michael Osterholm, thank you very much for joining. There is still clearly so much that we have to learn about this virus. I think if we've learned one thing, it is to be a little bit humble.
That's the operative word.
Michael, thank you very much for joining the program.
Thank you.
So, Carlos, I feel like we had a moment of optimism from Cynthia and seizing an opportunity with the work that she has been doing, perhaps to make things better even beyond the pandemic. And then listening to Michael, a dose of caution, perhaps, from the voice of medicine.
Yeah, overall, I take the combination as a good one. Katty, I'm one of these old school people, Neanderthals, who doesn't like to admit to having a tear in his eye. But I have to admit, Cynthia Finch earlier might have caused the first tear in my eye since we started the show. I was so incredibly moved by who she is, the work she's doing, the good energy that she brought to it, and that sense of camaraderie and public citizenship. I really was grateful that we got to know her.
Yeah, and I'm really glad that her list is getting a certain amount of fame, not just in the Knoxville area, but around the country as well. If something can be taken out of this whole experience that makes the country healthier and stronger and more united, wow, wouldn't that would be the silver lining in what has been a really, really obviously a terrible year for so many people. But if we can come out of it with something that we have learned that we can use, then maybe we can find some good out of it.
I think we can.
And she seems to be doing that.
She seems to be doing that indeed.
We hope you've enjoyed this episode of When Katty Met Carlos, a co-production from the BBC World Service
and OZY Media. If you've enjoyed this podcast, please leave us a review, tell a friend, and of course, don't forget to subscribe. Thank you, and we'll be back soon.